Welcome. Let's see what it is for, and how to use this medicine.
We start with a general summary, and then we will read the full package leaflet.
First of all, follow the instructions prescribed by your doctor, pharmacist or nurse.
Subscribe to the channel to receive new content and find us easily.
Let's get started. Vardenafil 20 milligrams, film-coated tablets.
The active substance Vardenafil is used for the treatment of erectile dysfunction in adult men, a condition which implies difficulties in getting or keeping an erection.
Vardenafil is a member of a class of medicines called phosphodiesterase type 5 inhibitors. At least 1 in 10 men has trouble getting or keeping an erection at some time. There may be physical or psychological causes, or a mixture of both. Whatever the cause is, due to muscle and blood vessel changes, not enough blood stays in the penis to make it hard and keep it hard. Vardenafil will only work when you are sexually stimulated.
Talk to your doctor or pharmacist before taking Vardenafil. Vardenafil is available in film-coated tablet, contains 5 milligrams, 10 milligrams or 20 milligrams.
The recommended dose is 10 milligrams. Take a Vardenafil tablet about 25 to 60 minutes before sexual activity. With sexual stimulation, you may achieve an erection anywhere from 25 minutes up to 4 to 5 hours after taking Vardenafil. Do not take Vardenafil more than once a day. Tell your doctor if you think Vardenafil is too strong or too weak. For patients with liver and kidney problems, the recommended starting dose is 5 milligrams. Do not take Vardenafil more than once a day.
Swallow 1 tablet with a glass of water. The tablet can be divided into equal doses. You can take Vardenafil with or without food, but preferably not after a heavy or high-fat meal, as this may delay the effect.
Very common side effect is headache. Partial, sudden, temporary or permanent decrease or loss of vision in one or both eyes has been experienced by patients. Stop taking Vardenafil and contact your doctor immediately. For more side effects information, please see the full package leaflet, following the link below.
Do not take Vardenafil if you are allergic to Vardenafil or any of the other ingredients of this medicine, if you have heart trouble, if you have a severe kidney or liver problem, if you have or have had low blood pressure. Do not take Vardenafil if you have recently had a stroke or heart attack, if your family has a history of degenerative eye diseases and loss of vision, if you are treating pulmonary arterial hypertension, tell your doctor.
Some medicines may cause problems, especially these nitrates, medicines for angina. These medicines with Vardenafil could seriously affect your blood pressure. Ketoconazole or itraconazole, antifungal medicines. Ritonavir or indinavir, medicines for HIV. Riociguat, used to treat pulmonary arterial hypertension.
Follow the instructions prescribed by your doctor, pharmacist or nurse, and ask them if you have any further questions on the use of this medicine.
Is this video useful to you? Leave a comment and subscribe to the channel. We will be glad to hear from you.
Now we will see the complete package leaflet.
Vardenafil 20 milligrams, film-coated tablets. Section 1. What Vardenafil is and what it is used for. Vardenafil is a member of a class of medicines called phosphodiesterase type 5 inhibitors. They are used for the treatment of erectile dysfunction in adult men, a condition which implies difficulties in getting or keeping an erection. At least 1 in 10 men has trouble getting or keeping an erection at some time. There may be physical or psychological causes, or a mixture of both. Whatever the cause is, due to muscle and blood vessel changes, not enough blood stays in the penis to make it hard and keep it hard. Vardenafil will only work when you are sexually stimulated. It reduces the action of the natural chemical in your body which makes erections go away. Vardenafil allows an erection to last long enough for you to satisfactorily complete sexual activity.
Section 2. What you need to know before you take Vardenafil. Do not take Vardenafil if you are allergic to Vardenafil or any of the other ingredients of this medicine, listed in Section 6 of this leaflet. Signs of an allergic reaction include a rash, itching, swollen face or lips and shortness of breath. If you are taking medicines containing nitrates, such as glycerol trinitrate for angina, or nitric oxide donors, such as amyl nitrite, Taking these medicines with Vardenafil could seriously affect your blood pressure. If you are taking ritonavir or indinavir, medicines used to treat human immunodeficiency virus, HIV, infections. If you are over 75 years of age and are taking ketoconazole or itraconazole, anti-fungal medicines. If you have a severe heart or liver problem, if you are having kidney dialysis, if you have recently had a stroke or heart attack, if you have or have had low blood pressure, if your family has a history of degenerative eye diseases, such as retinitis pigmentosa, if you have ever had a condition involving loss of vision due to damage to the optic nerve from insufficient blood supply known as non-arteritic ischemic optic neuropathy, NAION, if you are taking riociguat. This drug is used to treat pulmonary arterial hypertension, that is, high blood pressure in the lungs, and chronic thromboembolic pulmonary hypertension, that is, high blood pressure in the lungs secondary to blood clots. PDE5 inhibitors, such as Vardenafil, have been shown to increase the hypotensive effects of this medicine. If you are taking riociguat or are unsure, tell your doctor. Warnings and precautions. Talk to your doctor or pharmacist before taking Vardenafil. Take special care with Vardenafil if you have heart trouble. It may be risky for you to have sex if you suffer from irregular heartbeat, cardiac arrhythmia, or inherited heart diseases affecting your electrocardiogram, if you have a physical condition affecting the shape of the penis. This includes conditions called angulation, Peyronie's disease, and cavernosal fibrosis. If you have an illness that can cause erections which won't go away, priapism. These include sickle cell disease, multiple myeloma, and leukemia. If you have stomach ulcers, also called gastric or peptic ulcers, if you have a bleeding disorder such as hemophilia, if you are using any other treatments for erection difficulties, C-section, other medicines, and Vardenafil. If you experience sudden decrease or loss of vision, stop taking Vardenafil and contact your doctor immediately. Children and adolescents. Vardenafil is not intended for use by children or adolescents under 18. Other medicines and Vardenafil. Tell your doctor or pharmacist if you are taking, have recently taken, or might take any other medicines. Some medicines may cause problems, especially these nitrates, medicines for angina, or nitric oxide donors, such as amyl nitrite. Taking these medicines with Vardenafil could seriously affect your blood pressure. Talk to a doctor without taking Vardenafil. Medicine for the treatment of arrhythmias, such as quinidine, procainamide, amiodarone or sotalol, ritonavir or indinavir. Medicines for HIV. Talk to a doctor without taking Vardenafil, ketoconazole or itraconazole, antifungal medicines, erythromycin, or clarithromycin, macrolide antibiotics, alpha blockers, a type of medicine used to treat high blood pressure and enlargement of the prostate, as benign prostatic hyperplasia, riociguat. Do not use Vardenafil film-coated tablets combined with any other treatment for erectile dysfunction. Vardenafil with food, drink, and alcohol. You can take Vardenafil with or without food, but preferably not after a heavy or high-fat meal, as this may delay the effect. Don't drink grapefruit juice when you use Vardenafil. It can interfere with the usual effect of the medicine. Alcoholic drink can make erection difficulties worse. Pregnancy and breastfeeding. Vardenafil is not for use by women. Driving and using machines. Vardenafil might make some people feel dizzy or affect their vision. If you feel dizzy, or if your vision is affected after taking Vardenafil, don't drive or operate any tools or machines.
Section 3. How to take Vardenafil. Always take this medicine exactly as your doctor or pharmacist has told you. Check with your doctor or pharmacist if you are not sure. The recommended dose is 10 milligrams. The tablet can be divided into equal doses. Take a Vardenafil tablet about 25 to 60 minutes before sexual activity. With sexual stimulation, you may achieve an erection anywhere from 25 minutes up to 4 to 5 hours after taking Vardenafil. Swallow one tablet with a glass of water. Do not take Vardenafil more than once a day. Tell your doctor if you think Vardenafil is too strong or too weak. If you take more Vardenafil than you should, men who take too much Vardenafil may experience more side effects or may get severe back pain. If you take more Vardenafil than you should, tell your doctor. If you have any further questions on the use of this medicine, ask your doctor or pharmacist.
Section 4. Possible side effects. Like all medicines, this medicine can cause side effects, although not everybody gets them. Most of the effects are mild or moderate, partial, sudden, temporary or permanent decrease or loss of vision in one or both eyes has been experienced by patients. Stop taking Vardenafil and contact your doctor immediately. Cases of sudden death, fast or altered heartbeat, heart attack, chest pain, and trouble in cerebral circulation, including temporarily decreased blood flow to parts of the brain and bleeding in the brain, have been reported in men taking Vardenafil. Most of the men who experienced these side effects had heart problems before taking this medicine. It is not possible to determine whether these events were directly related to Vardenafil. Sudden decrease or loss of hearing has been reported. The chance of having a side effect is described by the following categories: very common, may affect more than 1 in 10 people, headache. Common, may affect up to 1 in 10 people, dizziness, flushing, blocked or runny nose, indigestion. Uncommon, may affect up to 1 in 100 people, swelling of skin and mucous tissue including swollen face, lips or throat, sleep disorder, numbness and impaired perception of touch, sleepiness, effects on vision, redness of the eye, effects on color vision, eye pain and discomfort, light sensitivity, ringing in the ears, vertigo, fast heartbeat or pounding heart, breathlessness, stuffy nose, acid reflux, gastritis, abdominal pain, diarrhea, vomiting, feeling sick, nausea, dry mouth, raised levels of liver enzymes in your blood, rash, reddened skin, back or muscle pain, increase in blood of a muscle enzyme, creatine phosphokinase, muscle stiffness, prolonged erections, malaise. Rare, may affect up to 1 in 1,000 people, inflammation of the eyes, conjunctivitis, allergic reaction, anxiety, fainting, amnesia, seizure, increased pressure in the eye, glaucoma, increased tearing of the eyes, effects on the heart, such as heart attack, altered heartbeat or angina, high or low blood pressure, nosebleed, effect on results of blood tests to check liver function, sensitivity of the skin to sunlight, painful erections, chest pain, temporarily decreased blood flow to parts of the brain. Very rare or not known, may affect less than 1 in 10,000 users or frequency cannot be estimated from the available data, blood in the urine, hematuria, penile bleeding, penile hemorrhage, presence of blood in the semen, hematospermia, sudden death, bleeding in the brain. Reporting of side effects. If you get any side effects, talk to your doctor or pharmacist. This includes any possible side effects not listed in this leaflet. You can also report side effects directly via Yellow Card Scheme at website www.mhra.gov.uk Yellow Card or search for MHRA Yellow Card in the Google Play or Apple App Store. By reporting side effects, you can help provide more information on the safety of this medicine.
Section 5. How to store Vardenafil. Keep this medicine out of the sight and reach of children. Do not use this medicine after the expiry date which is stated on the packaging after EXP. The expiry date refers to the last day of that month. This medicinal product does not require any special storage conditions. Do not throw away any medicines via wastewater or household waste. Ask your pharmacist how to throw away medicines you no longer use. These measures will help protect the environment.
Section 6. Contents of the pack and other information. What Vardenafil contains. The active substance is Vardenafil. Each film-coated tablet contains 5 milligrams, 10 milligrams or 20 milligrams Vardenafil, as Vardenafil hydrochloride trihydrate. The other ingredients, excipients, are microcrystalline cellulose, crispophytone, type A, colloidal anhydrous silica, magnesium stearate, E470B, in the tablet core and hypromellose, microgyl 4000, titanium dioxide, E171, yellow iron oxide, E172, red iron oxide, E172, in the film coating. What Vardenafil looks like in contents of the pack. 5 milligrams film-coated tablets. Film-coated tablets are orange-brown, round, slightly biconvex, with beveled edges, engraved with 5 on one side. 5.5 millimeters in diameter, 10 milligrams film-coated tablets. Film-coated tablets are orange-brown, oval, slightly biconvex, scored on one side and engraved with 10 on the other side. Dimensions 10.5 millimeters x 5.5 millimeters. The tablet can be divided into equal doses. 20 milligrams film-coated tablets. Film-coated tablets are orange-brown, round, biconvex, with beveled edges, scored on one side and engraved with 20 on the other side. 10 millimeters in diameter. The tablet can be divided into equal doses. Vardenafil is available in boxes containing 2, 4, 8, 12 and 20 film-coated tablets in blisters. 2, 4, 8, 12 and 20 film-coated tablets in unit dose blisters. Not all pack sizes may be marketed. Marketing authorization holder and manufacturer: Krakow, DD, Novo Mesto, Smarjeska Chesta 6, 8501 Novo Mesto, Slovenia. This leaflet was last revised in February 2020. End of document.
The information in this video comes from published documents by the UK Medicines and Healthcare Product Regulatory Agency, the European Medicines Agency, and the US National Library of Medicine. If you like this video, please support the creation of new content by subscribing to the channel. Thank you.